what do we actually look at when we're talking about pelvic floor?
So essentially the pelvic floor is the base of our whole pelvis. So you've got superficial muscles and you've got deep muscles. Mm-hmm. And essentially these muscles wrap around the pelvic organ. So they wrap around the bladder, the uterus for a female, and the rectum. Mm-hmm. And the main job of the pelvic floor is to hold up these organs into the pelvis to stop you leaking from the bladder and the bowel, so they control continence. They play a really big role in sexual function. And the pelvic floor also has to relax really well for you to be able to empty your bladder and empty your bowel. So the pelvic floor is just that whole space on the bottom of the pelvis.
Yeah. And in terms of relationships with the rest of the body, then you mentioned abdomen as well as an area that you kind of look into as well when treating women or when managing women.
Yeah.
What's the relationship a little bit there for someone who might not know as well?
So the pelvic floor is the base of the whole core canister. So if you think of the core canister, the pelvic floor is the base. The diaphragm, which is our breathing muscle, is the kind of lid to the canister. Yep. And then you've got your core muscles which wrap around. So these all have to be working optimally together to have a functioning core canister. We look at all of those aspects. We look at how women breathe, how they turn on their core, if they're too grippy through their core, if they're underactive through their core. Same with muscles of the pelvis, like the glutes, the adductors, all of that.
Yeah.
So they all have a really close relationship.
Yeah, strong kind of tie. And I like how you talk about it as a canister. I feel like anytime people think of abdomen, they're like the six-pack muscles or the no six-pack muscles. But you're right, like it really does wrap around, from the side all the way through to the front. In terms of like, I suppose where you frequently will see someone or someone comes in to see you at the clinic, what are the typical reasons that people will actually present to see you?
So if someone's pregnant, ideally, we want them to come in even if they have no symptoms.
Yeah.
We want them to come in for a pelvic floor screening so we can make sure that, one, they're contracting their pelvic floor correctly. Because we know from research that about 20 to 30% of women actually bear down when they squeeze their pelvic floor instead of drawing up, which you can imagine if they're doing that their whole pregnancy, they're just going to be putting strain on all of the tissues and the muscles. So we want to make sure that they're doing it correctly. Mm-hmm. And then we want to see if their pelvic floor is functioning properly. So we want them to be able to squeeze, let go, because what a lot of women don't realise is that when you push a baby out, so if you're planning on having a vaginal delivery, you push a baby out, your pelvic floor has to stretch 2 to 3 times its size, 2 to 3 times its resting length to get the baby out, right? So to put that into perspective, the hamstring would tear at like 1.2 times its resting length.
Right.
So we want to make sure that they can lengthen it, they know how to push correctly.
Yeah.
So that they can have better birth outcomes.
Yeah. And avoid the risk of tearing and other complications.
Yeah, exactly. Yeah. So from a pregnancy point of view, we want them to have no symptoms coming in so that we can check everything and try and optimize their outcomes. But even more so if they're having symptoms. So if you're experiencing any urinary incontinence during the pregnancy, we want you to come in because we know that if you experience that in pregnancy, you have a higher risk for experiencing that postpartum.
Yeah.
And then postnatally, same thing. Most women feel okay at 6 weeks, but then we do a pelvic floor assessment, we do a core assessment, and there's so much that they need to work on. So in those two kind of groups of people, they don't necessarily have to be having any issues. Yeah. But with the general population, some common pelvic floor issues would be urinary incontinence. So that is if you leak with a laugh, a cough, a sneeze, but also if you leak with an urge. So some people leak on the way to the bathroom and they can't quite hold it because their bladder's going into spasm. Yeah. Women with prolapse symptoms, so that's a dragging feeling in the vagina, a heaviness. Yeah. Women with pelvic pain, symptoms with like endometriosis, constipation, things like that.
Yeah.
A whole list of
so
symptoms.
many different rabbit holes.
Yeah. And do you think we're moving? So we've had a conversation going over the last how many episodes now about the push for like preventative healthcare and how There needs to be like
Not just
almost
putting fires out.
not putting fires out, not waiting to the last second to go in and see a healthcare practitioner
Yeah.
on the premise that you think there's not a lot going on.
Yeah.
Do you think there's really good validity even for your general pop patients, like you were talking about before, that might not be pregnant, but like before they start experiencing symptoms? Do you think there's good validity to get in and just see someone, even just for a quick screen or a quick checkup or a hi, my name is?
Yeah, absolutely. I think we're in such a good position to be able to prevent birth injuries and optimize birth outcomes. So I love it when I sit down and I say, what have you come in for, to my patient? And they say, well, I'm not pregnant yet, but I just want to see what my pelvic floor is like. Cool. And that's awesome because we have so much time. Yeah. We can figure out, okay, we need to be doing this before you're even pregnant. Where if someone comes in, we can always be working on things, but then we're against the clock. There's a little bit less time. So that's the ideal scenario.
Thanks for listening to this week's podcast.
Be the first to know when the next episode drops by hitting subscribe on wherever you catch your podcasts.
And don't forget to follow us on Instagram at wedon'tknowyet.pod.
See ya.